The South Korean health authorities are saying that the country has passed the peak of this wave of COVID-19 and they're looking at easing the social distancing rules next week. Today, new cases came down to a little under 350,000. Choi Min-jung has the latest.
South Korea on Tuesday reported 347,554 new COVID-19 infections. Daily cases were slightly down by around 6,400 on week. With the country now having passed the Omicron peak, authorities forecast daily infections to drop to less than 300,000 within the next 2 weeks and below 200,000 within a month. With this outlook in mind, officials are considering relaxing current social distancing rules, which are set to last until this Sunday. Currently, gatherings of up to 8 people are allowed, and most businesses must close by 11 p.m. Authorities say there's a chance of cases spiking if restrictions are all eased at once, but they have been gradually easing restrictions.
Now is the time to encourage people's voluntary efforts rather than imposing strict measures.
There are also plans to expand treatment options for COVID-19 patients recovering at home.
The treatment of outpatients, which was mainly handled by medical centers specializing in respiratory diseases, will now be expanded to other hospitals and clinics as well.
Infected people who wish to receive face-to-face treatment can visit clinics and hospitals after making a reservation. This is allowed even if they are under quarantine. However, medication must be picked up by someone who doesn't have COVID-19. To prevent infections at clinics and hospitals, officials say they will have separate diagnosis times and areas for COVID patients. Meanwhile, severe cases remain high with over 1,200 people in critical condition. There were 237 additional deaths. Authorities have said that these figures could peak in the next 2 or 3 weeks. Experts predict the number of severely ill patients to reach somewhere between 1,300 and 1,680 at its peak. The figure is then expected to drop sometime in April. Choi Min-jung, Arirang News.